Well, we are team number 1 and we will be present the topic of nutrition. This is my team, so let's start.
First of all, we will see some keywords of the topics we will see in a couple of minutes. Let's see it. Nutrient. Chemical product that comes from outside the cell and that it needs to perform its vital functions. It is divided into two groups, macronutrients and micronutrients. Macronutrients is in this group are three fundamental nutrients like lipids, carbohydrates, and proteins. Micronutrients, they are what we know as vitamins and minerals like iron, calcium, zinc, vitamin D, and folic acid. Types of menus. There are many types of menus, one that is healthier than other ones, but why is this is healthy and the others not? It's because of the number of calories each of them has. Eating disorders. There are many disorders, but the ones that are more common are obesity, overweight, anorexia, and bulimia. The consequence of these issues is that they are having a normal life and a malnutrition problem. Obesity. Loss of balance and excess of calories combined with having a normal life. Anorexia. Anorexia is characterized by a distorted body image and unworried fear of gaining weight. Bulimia. Bulimia is a life-threatening eating disorder. People with this disease eat compulsively.
Now we will see important concepts. I'm Oscar Giuseppe Ornella, so let's start with this. The first one is food, material, especially carbohydrates, fats, and proteins that an organism uses for energy, growth, and maintaining the process of life. Then these are the nutrients. Nutrients are organic and inorganic substances present or containing in food which is required or necessary for growth and maintenance of function of body. Then the calorie. The calorie is a unit of energy defined as the amount of heat needed to raise a quantity of water by 1 degree of temperature. And then diet. In nutrition, diet is the sum of food consumed by a person or other organism. Then balanced diet. A balanced diet is one that provides the body with all the essential nutrients, vitamins, and minerals required to maintain cells, tissues, and organs as well as to function correctly. Nutrition. Nutrition is the study of the nutrients in food, how the body uses them, and the relationship between diet, health, and disease. Then we have the malnutrition. Malnutrition refers to excess or imbalance in a person intake of energy and or nutrients. And then nutrition fact level. The nutrition fact level, also known as the nutrition information panel, is a label required on most of the packaged food in many countries, showing what nutrients to limit and get enough of are in the food.
Now I'm going to explain the kind of nutrients, its characteristics, functions, and its importance in teenagers. As we have said before, nutrients are a chemical product that comes from outside the cell and that it needs to perform its vital function. It usually comes from the diet and play an essential role in metabolism. To determine how much a person should consume regularly, we can rely on the reference daily intake, which is the suggested amount of energy and nutrients according to the research done on a large number of people. Next, we will talk about the recommendations of some of them, according to the RDA. Macronutrients. They are required in large quantities and are necessary to produce energy and form new structures. They include three important groups of nutrients: carbohydrates, proteins, and lipids. Carbohydrates. They are the primary source of energy in the diet and are obtained from foods such as fruits, cereals, and legumes. Another type of complex carbohydrates, which includes foods rich in starch, such as cereals and their derivatives, and undigestible carbohydrates, like fiber, which is an essential nutrient as it helps maintain proper gastrointestinal function and prevent disease. The recommended intake for total carbohydrates for adolescents is 130 grams per day to 45 to 60% of the daily energy needs. It is recommended to limit the take of simple carbohydrates like soda and candy to 10% of the suggested total since a higher consumption promotes overweight. Active young people need to increase their intake of carbohydrates, while sedentary people should decrease its consumption. Some of the sources of carbohydrates are cereals and derivatives such as corn, wheat, rice, oatmeal, tortilla, fruit desserts, sweets, among others. Then we have proteins, which are necessary elements because of their role in different functions of the organism. They have a role in the immune system. They also act as enzymes that allow the various chemical reactions to take place in the organism, among others. Proteins are made up of amino acids, which are classified as essential and non-essential. The essential amino acids are so called because the organism can synthesize them and most obtain them from the diet. For adolescents, amino acids are indispensable to maintain and increase muscle mass. During the period of maximum growth in women between 11 and 14 years old, and in men between 15 and 18 years old, the recommended intake must be met. The recommendation is 0.8 to 1 gram to protein per kilogram of body weight, 10 to 15% of the diet. If the adolescent doesn't meet this requirement, his proper development may be interrupted and may lose muscle mass. There will be no increase in height or weight, and deficiency diseases may show up. Sources of protein are foods of animal origin, legumes such as beans, lentils, chickpeas, soybeans, beans, oilseeds like walnuts, almonds, peanuts, and sesame seeds. Finally, we have lipids. These groups correspond to fats. During adolescence, this nutrient is essential since it is required for healthy growth and development, as well as for a proper hormonal functioning. Fats store energy and provide more calories per gram than carbohydrates and proteins. The maximum lipid recommendation is 30%, no more than 300 of milligrams of cholesterol, less than 7% of saturated fat or animal, 7 to 10% polyunsaturated, and 10 to 20% monosaturated. Both mono and polyunsaturated are considered healthy fats. Sources of monounsaturated fat are avocados, canola oil, walnuts, almonds, peanuts, olive oil, and olives. And sources of polyunsaturated fat are nuts, sunflower seeds, flaxseed, salmon, herring, tuna, trout, corn, soybean, and safflower oil. The micronutrients. They take their name from the amount of them that is required, which is minimal. The name of micronutrients does not mean that they lack importance or we can live without them since they have a bigger role for us. Micronutrients are what we know as vitamins and minerals. Vitamins are organic compounds necessary for a specific chemical reaction, as well for healthy growth and development. Minerals are inorganic elements that humans require in small quantities, but like vitamins are very important because without them, we couldn't perform metabolic functions that are vital to keeping the body in perfect conditions. For example, the synthesis of tissues and the functioning of hormones. During adolescence, micronutrient need increase to maintain healthy growth and development. Micronutrients are mainly involved in the synthesis of muscle mass, bone, and blood cells. Usually, men need more micronutrients, except for iron, which is required more by women because of their menstrual periods. Each micronutrient is described in the next slide. Calcium. This mineral is vital because it constitutes part of the bone mass, and almost half of the bone mass a person will have for the rest of his life is made during adolescence. This latter is the period when more calcium is reabsorbed by the bone. Therefore, it is essential to have an adequate intake of calcium to avoid the risk of fractures or osteoporosis later. Sources of calcium are dairy, oats, soy, broccoli, nuts, legumes, anchovies, seaweed, among others. Then we have iron, which among the factors that cause a significant increase in iron requirements during adolescence are growth acceleration, increasing blood volume, and the onset of menstruation in women, menarche. Anemia is more common in this period among teenagers due to iron deficiency, which is usually caused by insufficient iron reserves before puberty. Sources of iron: nuts, dehydrated fruits, egg yolk, liver, red meat, salmon, and tuna. Zinc. This is another critical element during adolescence. It is required for the mineralization of bones, sexual maturation, synthesis of proteins, and nucleic acids. Zinc deficiency shows up as weight loss, frequent infection, i.e. hypohondroidism. Sources of zinc are fish, poultry, meats in general, nuts, and lentils. Vitamin D. This vitamin is considered essential to facilitate the intestinal absorption of calcium and phosphorus. It can be synthesized inside the organism as long as there is sunlight exposure to the skin. So, if vitamin D is lacking, boars are not able to absorb calcium and also lost the one that is already inside them, increasing their fragility. Sources of vitamin D are fatty fish such as salmon, tuna, herring, fish liver, oils, and eggs, whole milk and its derivatives, folic acid. The recommended folic acid intake is between 150 and 200 UG per day, especially in adolescent women. It is an essential vitamin during the reproductive age. Therefore, its use is recommended as a preventive measure in the case of men. It is necessary, especially in the largest state of adolescence, to meet the requirements for the calcium accumulation of muscle mass. Some sources of folic acid are green leaves, legumes, lentils, beans, fortified cereals, and some fruits.
Hi, so I'm going to talk about the healthy menus and the unhealthy menus. Well, in this case, here's a picture of the salads and the burgers or sandwiches. Now in the next slide, I will tell you the comparison between them. In the healthy menu, we have salads. Salads, depending on the ingredients, usually contain in average around 120 to 400 calories without dressings. These salads usually contain legumes, fruits, vegetables, carbs, and protein, and all of these things are vital and necessary for the body. In the unhealthy menu, we have a cheeseburger, a cowboy burger, a crusted chicken, and a Ford cheese. All of these foods normally contain in average 600 calories, and they usually have a lot of grease, which if fried is unhealthy to you and can go the wrong way. This type of diet can lead to cardiovascular diseases, obesity, diabetes, or others. Another example of an unhealthy menu is the one in the left, which, as you can see, is food from IHOP and like milkshake and fries and everything. It does not manage hunger, which means you are still hungry. It does not have enough protein. It does not manage energy, but people consume it because it tastes really good. And the healthy menu manages hunger. It has enough protein. It is energy lifting, and it also tastes awesome.
Okay, so now I'm going to continue with the causes and consequences of obesity, overweight, anorexia, and bulimia. So, obesity and overweight. These conditions are caused by an imbalance between the calories consumed and those spent through the day. Obesity is not only an image problem, but it also brings other issues as a consequence that can be psychological, like low self-esteem, anxiety, depression, hindered mobility, and of course, health in general. Overweight and obesity problems are not limited to the increased risk of diabetes mellitus, but as a consequence, they can also include chances of suffering certain types of cancer, such as breast cancer, respiratory, cardiac, and hypertension problems, as well as liver diseases and joint injuries. Now we have anorexia. So a food restriction below the requirement leads to a very low weight, lower than the minimum expected for the age and height of a person. The patient feels an intense fear of gaining weight or becoming obese, even when they are underweight, and has an evident alteration in that perception of her or his weight and body shape. So now some of the causes that may increase a person's risk of having anorexia are criticism about their eating habits, weight or body shape, a history of teasing or bullying, especially about their weight or body shape, low self-esteem, anxiety, having a personality that tends toward obsession and perfectionism, sexual abuse, and if they have a history of dieting. The complication and consequences of having anorexia are severe, and they can be problems in the cardiovascular system, the blood, such as low white or red blood cell count, complications in the digestive system, the kidneys, hormonal imbalances, and bone strength. Finally, we have bulimia. So bulimia is characterized by a recurrent binge eating with behaviors that are called compensatory, which are inappropriate and frequent to prevent gaining weight. For example, bulimics include vomiting, use of laxatives, diuretics, enemas, fasting, and excessive exercise. They practice these activities once a week for a period of 3 months on average. People who suffer from this disease access themselves in an exaggerated way and consider themselves extremely overweight. It is thought that multiple factors contribute to the development of this eating disorder, including genetic, environmental, psychological, and cultural influences. Some of the main causes include stressful transitions or life changes, history of abuse or trauma, negative body image, and poor self-esteem. And finally, we have the health consequences of bulimia that are most often related to the purging behaviors, and they can be dehydration, electrolyte imbalances, irregular heartbeat, heart failure, tooth decay, acid reflux, inflammation and rupture of esophagus, intestinal distress, and irritation. So thank you. That was it for our presentation, and we hope you find it interesting.
Well, here you have the reference if you want to check some of the information of the presentation. Thank you very much.